Well, if you're someone who has bunions, you know how painful they can be. In fact, doctors perform about 500,000 surgeries every year to try to take care of them. Sunrise reporter Roland Rodriguez is at Doctors Regional Hospital this morning. And Roland, I understand that there is something new happening for these people, and it's happening right here.
Good morning, Mike, and good morning, South Texas. A lot of folks know that open bunion surgery can be really painful and keep you off your feet anywhere between 6 and 8 weeks. One area doctor is doing a procedure that's getting people back on their feet much quicker.
And then you're going to go all the way into the right.
Bunions occur in about 30% of the population. Anyone can get bunions, but they are more common in women.
A bunion, again, is caused from many different things. It could be arthritic. Gout, believe it or not, can cause bunion deformities also. Shoe gear can cause bunions, whether you're wearing too narrow of a shoe. I always recommend people get into wider shoes because that bump can rub a narrow shoe and be really irritated.
A bunion is a bony bump that forms on the joint at the base of your big toe. It forms when your big toe pushes against your next toe, forcing the joint of your big toe to get bigger and stick out.
Again, so a bunion is a enlargement of the joint on the inside of the big toe. It can be red, swollen, or inflamed. People will complain of stiffness with the big toe joint.
For those who need surgery, orthopedic foot and ankle specialist Dr. Corey Goolsby is one of the first area doctors to perform a minimally invasive surgery at Corpus Christi Medical Center.
And so what we're doing is small micro incisions for this bunion correction. It's about 3 little poke holes that are less than about 5 millimeters or shorter than the end of a pencil head of an eraser.
With this technique, patients will typically have less pain and swelling after surgery with a lower risk of infection.
With the open procedure, patients are off their feet for could be anywhere from 6 to 8 weeks of total non-weight bearing or no pressure on their foot. And with these minimally invasive bunion procedures, now we're getting patients back into shoes in 2 to 4 weeks, depending on the health of the patient and the seriousness of the deformity. But we have patients walking as early as 3 days after surgery.
And of course, we will have more information on bunions later this morning on our website at kristv.com. Now let's head back to the studio and check in with Mac and our morning weather. Mac.